shows basically there is a gap between the government expenditures and out-of-pocket expenditures. So government expenditures may be for temporary because of the pandemic, and obviously the government is stepping in and spending it. So this is temporary, and when in the long term, so probably government will withdraw. So what kind of the solution would you like to, I mean, this is your kind of research, and out-of-pocket expenditure should increase or decrease, or what kind of solution, or government should always be there for promoting healthcare?
So the out-of-pocket expenditure should be reduced. There is no second thought on that. But the ways to reduce it, because this out-of-pocket expenditure is responsible for dragging millions below the poverty line. It has to be addressed. But who has to address it? The burden lies on whom? That's where the business process innovation comes in, because the private sector plays a significant role in the healthcare system of India. Target of reducing the out-of-pocket expenditure cannot be efficiently done by the government alone. It has to be coordinated, cooperated, and collaborated with the private healthcare system, and these has to be done through business process innovation, and there should be some government incentivization, like provision of some concessional loans, providing some easy regulatory clearances, by making some variation, some amendments in the clinical establishment tax. These will actually boost the private sector to adapt various business process innovations, thereby reducing the out-of-pocket healthcare expenditure.
Okay, one or two more. Yeah, good.
I have more doubts. So you have taken 60 female headed households. So why you have taken only females? Because out-of-pocket expenditure is universal to the gender. So why have you taken only females? And also you have mentioned that you have taken only direct cost as out-of-pocket expenditure, but it includes indirect cost as well. Have you taken that indirect cost as well or not? And third point, that is, you told that Ayushman Bharat does not care about the primary care, but the first objective of Ayushman Bharat is to increase health and wellness centers, and there are many additions have come in the health and.
So addressing your first question, I have chosen female head of the household because those villages, those areas were notorious for the male selective migration in search of livelihood to the urban centers. So when we were there during our field work visit, we couldn't find much of the male persons there. So that's why we have chosen only the female head of the households, because moreover they are readily available. We can get easily we can easily interact with them. They will provide necessary information. In terms of convenience also, we have chosen that. Second question is with respect to that indirect expenses. So the problem with these indirect expenses, like the expenses associated with the transportation, pharmacies, these are very difficult to quantify actually in the process. It's difficult to pinpoint this is the exact quantity of these expenses. So that's where the gray area comes in with respect to the indirect expenses. And third one, with respect to the health and wellness centers, I'm focusing more on universal health coverage aspect of the Pradhan Mantri Jan Arogya Yojana. Health and wellness center is more of the preventive aspect. They are more concerned with the preventive aspects and promotive health, preventive and promotive health. Their Jan Arogya Yojana, that the second component, focusing on secondary and tertiary, they are focusing on the universal health coverage in terms of reducing the out-of-pocket expenditure.
One more. Sorry. Okay, let us go.
Actually, very nice presentation. And one immediate suggestion was like you have a lot of public policy recommendation we are actually searching for, where the role of local government is huge, like personally, when you talk about doorstep initiatives and so on. So where is there any possibility to look into those perspectives where Kerala is the health index is the highest and Uttar Pradesh is the worst. And if you compare, in other case, Kerala, in terms of local government framework in general, if you talk about, it's a huge. So it's a very good performing world in terms of infrastructure, in terms of devolution of powers, function, funds, and whatever. And in other side, it is a host in terms of that. Even in the so, is there any possibility or will putting into the recommendation these local government issues? Because local government, they have different subjects.
We don't respond to everything you can say. Yes. That's a big station.
Okay. Okay, sir. Okay, sir. So, just adding a few words to yours. That's why I have mentioned that collaborating with the cooperatives in the development of healthcare infrastructure to address with the help of community engagement and support of the local governments. Thank you. Thank you.